Welcome back to Youth Justice Transformation in Action. We are the RFK National Resource Center for Juvenile Justice, and we are on a mission to transform the youth justice system by partnering with people like you who are passionate about improving outcomes for youth, families, and communities you serve. You can find us at rfknrcjj.org or on Twitter at RFK Youth Justice. We are your hosts. I'm Jody Martin.
I'm John Tuell.
And I'm Michelle Darling.
In this bonus episode, Assessments 101, The Fundamentals, John and Dr. Vincent will continue to talk about the research and their experience with assessment drivers, collaboration with system stakeholders on the utility of assessments, data systems, and effective initial and ongoing implementation practices. Now let's jump back in with John and Dr. Vincent.
Gina, as I said earlier, you've done a lot of work in studying the drivers of risk and needs assessment instruments. You actually, along with your colleagues, authored a bulletin sponsored by the Office of Juvenile Justice Delinquency Prevention that supported research findings on factors that promote the effective implementation of risk and needs assessment instruments in the juvenile justice system. I'd like to highlight 2 or 3 of those drivers and ask you to speak about the importance of those drivers in effectively putting these practices into place. And I'd first like to start with your comment about the importance of developing policies and procedures and the method by which those are developed to ensure consistent application.
I think everyone in justice settings knows policies and procedures are important. It is very important to have this stuff written down. When is the assessment going to be done? Who's going to do it? Where is that information going to go and how? When are reassessments going to occur? Who's going to do it? Which youth are eligible to have all of these done? So you really, if you want to put a good assessment plan in place, it should be all youth at a certain decision point, as we refer to it, or all youth are getting a risk screen and then you're deciding who goes on to get an assessment, but all youth should be getting it. So you need a policy that is feasible, that your staff can follow. And another important piece of that policy we've already touched on a lot, John, is that initial assessment should be done predisposition. It's really got to be done predisposition. So that's a really important part of the policy. You want it to be feasible, people adhere to it, and all staff know how to do it. We've seen some policies be put in place that are a little loose in terms of who's eligible to get assessments done. What ends up happening is lots of kids get missed. You're going to have it, first of all, it's not fair. But second of all, your outcomes are not going to be great.
Yeah, and Gina, true that also, it's really critical that these probation policies and procedures are not done in a vacuum. That in fact, the collaborative work with judges, with attorneys, with your other stakeholders, they should have a role in the development of these policies and procedures to ensure consistent application and sustainability of the procedure. Would you agree?
Absolutely, John. And as you know, we spend 6 months to a year just working with these agencies around that policy development, because all of those individuals really should be comfortable with the policy that's coming out and be bought into it or it doesn't work. Another group that we have been recommending more often be included at some point are service providers, because that's a big piece. But one last thing about the policy is that the kind of policies we've talked about when is it done, how is it done, where does that information go, that's just a piece of it. The piece of policy that often gets missed or doesn't get written is how is this information supposed to be used? What is it supposed to be driving? And that's the biggest issue. If you're not using this risk assessment to make decisions, it is not going to make any difference. And so that part of the policy is really what needs to be discussed with the judges, the attorneys, the providers on some level.
Absolutely appreciate you amplifying that. And then if those policies and procedures are drafted, you've cited the ongoing support and training from supervisors as a critical driver of success. Can you comment on that a little bit, Gina?
Yes. So I'm going to just say really quickly that implementation science has documented very well that training staff, simply training your staff, does not change their behavior. It increases their knowledge and may increase their skills, but it does not change their behavior. And what we want to do when we're implementing any evidence-based practice, I don't care if it's risk needs assessment or MST, you're changing staff behavior because you're changing the way they do their work. And training alone doesn't do that. And I still see agencies over and over again, I don't care if it's juvenile justice or mental health or education, thinking that all it takes to implement something is to train their staff. You also need good policies and procedures, which we've also discussed, which have good buy-in, and ongoing booster training. Ongoing booster training is a must. And the other must is ongoing supervision and coaching. Make your supervisors learn all of this stuff as well and become coaches and have a process in place about how often they're going to check people's case plans to make sure that it's aligning with the risk needs assessment, how often they're going to check their PO's disposition recommendations for the same reason. That is actually one of the biggest drivers to good implementation.
Couldn't agree with you more. Our approach at the National Resource Center has enlisted the partnership of the University of North Carolina Frank Porter Graham Impact Center. Dr. Robin Jenkins has been a partner for us in the Mondoro project. And the reinforcement of your point there, Gina, is evident in the results that are being produced when we pay attention to supervisory training, providing the skills for supervisors to effectively provide that continuous learning oversight to the practices. In addition to that training piece, it's training, coaching, mentoring, supporting. And thankfully, we had developed a wonderful partnership with the Impact Center. We'll continue that, and it's producing the kind of results on this kind of practice as well as every other practice where we're trying to implement change in the youth justice system. Comment real quickly on another important driver, Gina, and that's the whole building that strong data infrastructure.
I just want to say very quick, this cannot be underestimated. We've seen this be one of the biggest drivers to an implementation effort flopping. So if you don't have that risk needs assessment programmed into something electronically, whether it's your existing case management system or it's web software that you're getting from, Orbis Partners or somebody else, if you don't have that set up before you implement the instrument and expect all your staff to be doing it on every youth, that causes problems because they're in an electronic world now and they're used to doing things electronically. So that causes problems. But the biggest issue is having your case plan or service plan or whatever your agency calls it also in your electronic system, and it should be aligned with that risk needs assessment, and it should be aligned with risk need responsivity. We spend months just working with agencies on how to reshape their case planning or their service plan so that everything's aligning and the process is seamless. And if that is not changed in that data infrastructure, we hear from supervisors and leaders all the time, well, staff can figure this out, they know how to do it, so we'll just instruct them how to fill this out, our same form out, but they're going to fill it out differently. No, it doesn't work. It doesn't work. We've seen it many times. So your data infrastructure is really important, but obviously the third reason that it's important, and I'm sure, John, you can attest to this, is continuous quality improvement is essential for any implementation effort. So if you want to be tracking your data, you want to be doing that, it's the PDSA cycles where you're looking at, did this work? And if it didn't, how do we adjust it? You want to be constantly looking at your data and seeing if you're getting the outcomes that you should be getting.
Gina, those are great responses, and I'm appreciative that we could amplify these important drivers of success for our listeners. There's no one more important or less important than the other. They are interwoven in the formula for success. And I appreciate, once again, you highlighting the research you've done and highlighting these particular elements of effective implementation. I do want to go back for just a second, give you a chance to maybe comment again on the notion of the inherent racial bias of the instruments.
Just really quick, there's 2 points. And Jody Villion and I put out, I think, a pretty clear, short piece on this in Criminal Justice and Behavior that summarizes some of the issues. There is this misperception because of some media that came out that all risk assessments are racially biased against people of color. That's simply not true. There's been a lot of peer-reviewed research published now on various instruments showing that they're not racially biased. You've got to pick an instrument where that evidence is there. You've got to pick an instrument where the people who validated it across race did it correctly in the way that is most widely accepted by our science, okay? Because there are ethical procedures around how you do this. So several risk assessment instruments have now undergone that kind of validation to ensure that they're not being racially biased. And what that means for us from a psychometric standpoint, a tool would be racially biased if scores on the instrument meant something different for one group than it does for the other. So for example, if a high score on this instrument among Black youth didn't mean that they were going to go on to reoffend, whereas a high score for white youth meant that they were going to go on to reoffend, that's bias, and that's bias in a way that could have a really negative impact. So your tool has to be tested in that way. Most do not have this bias, but the issue when you said inherent bias, John, that's really important is instruments that are based entirely on one's official juvenile record are going to be a problem. We know that there is racial disparity in our juvenile records. We know there's racial disparity in who gets arrested, who gets convicted,
Absolutely.
who gets failure to appear, who gets violated. And if your tool has nothing but items like that, it's going to have inherent racial bias that is difficult to detect statistically. So we constantly warn against that.
I think that's really important to have that honest discussion and to share those incredibly valid points about these instruments and the historical and ongoing concerns we have about racial and ethnic disparities in our youth justice system. So I appreciate that. Gina, you have had an enormous impact on the field as a result of your work over the last, I should leave out the number of decades so that I don't get in any trouble with you, Gina.
Yes, please do.
Okay, you've got an enormous impact, Gina. And we've gotten to share some of that impact today. Would you give us a little sneak peek about any of the upcoming work that you're doing that's going to continue to advance the juvenile justice system?
Thank you for asking, John. I have a grant from the National Institute of Justice right now that I'm really delighted that they were willing to fund, and I'm really excited about. So I'm partnering on this with Council of State Governments, Josh Weber, who many people know, and Jennifer Scheme, who is just, an amazing researcher in our field. We're partnering on this together, and we have 3 state partners: Wisconsin, Pennsylvania, and Virginia. And what we're looking at is essentially positive youth development. We're doing a study on protective factors and strengths-based services and how well they do compared to risk factors and risk reduction services. And at the end of this study, the idea is to be able to inform probation officers and juvenile justice agencies around how do you use protective factors and strengths-based services in your case management. Because there's a lot of talk about how important these are, but we don't have a good recipe for how you do that yet, and that's because the science isn't there. And so that's the intention of this study.
How long is the project? When will we see the results?
We're in our first year, and you know how these things go.
Yes, I do. We can look for it, Gina, and if the past is prologue, then every one of the pieces of work that you'll be doing going forward will match the impact on what you've developed up to this point. If you could change one thing, Gina, in a nutshell about youth justice, what would be your pronouncement about what we need to change?
Wow. That is a really good question. And I have to say that I have done some work with the adult justice settings, and I just always want to go back to the juvenile justice setting because there are people who have embraced reform efforts. They're more open-minded. They're just, and it could just be the agencies that I end up working with, but I have seen tremendous efforts in the juvenile justice system. And so I think, the next big piece of reform, in addition to making sure your risk needs assessment is done predisposition and actually being used in decisions, I think the next big area of reform is really around ensuring that what you're doing is somewhat data-driven. So look at your data and see if decisions are being made based on severity of offense and how well they would have done if you had based them on a risk assessment instead. I guess that means 2 areas of reform. I'd like to see severity of offenses us just not putting as much weight on that. In general, we're going to always have to put some weight on it. Obviously, you have to, but risk assessment should always be part of that decision. That's one. And the other one is maintaining data, making sure you're documenting every kind of service youth are getting so we can really see which services are getting us the best value, and doing that continuous quality improvement. I think those are 2 big things.
Thank you, Gina. I think that you have an extraordinary opportunity to continue to impact the field. We at the National Resource Center are always aware that when we are citing your work, we are citing credible, solid research, and it's a foundation of our work in the field to try to get juvenile justice and youth justice stakeholders to embrace the positive opportunities to improve the outcomes for our youth. We appreciate your contribution to the field and look forward to our continued partnership with you. It's been a pleasure hearing your wisdom, your thoughts, and your perspectives today on the risk needs responsivity instruments and the youth justice system. Thank you, Gina.
Thank you, John. It was my pleasure.
That was an informative conversation with John and Dr. Vincent on the importance of assessments. For more information on assessments and the work of RFK National Resource Center, check out our website, rfknrcjj.org, and follow us on Twitter at RFK Youth Justice.